The use of those types of tests, you know, the discussion I generally have with the patient is, what do you plan on doing with the information? If a person comes in and you know, for whatever reason, and I don't really make the decision for the patient as to what their treatment is. We know in standard medicine, conventional medicine, oncology, the only treatments that are presently available for cancer, no matter where it is either surgery, chemotherapy, radiation, or now biologics, you know, specific immune type things. So you have 4 approaches. So generally, you know, in my patient population, a certain percentage of people come in and either have a parent or a sibling or their next door neighbor who has had a similar type experience, and for their own spiritual, you know, belief system, they're deciding under no circumstance would they do it. And I'd say, well, under no circumstance, why would you want an x-ray then? Because if you're not going to follow the treatment plan that's going to be recommended to you, and you wish to do something else, I don't personally need an x-ray to decide what my treatment would be. If the person maybe would do the conventional approach in addition to biological approach, I'd say then get an x-ray. You'll find it as a baseline for what's going on. So like everything in medicine, it becomes individualized, and that's part of the discussion. And it's not you know, one size fits all. It has to be individualized to the person. And I have a fair number of people who have had cancer who have chosen not to do any conventional therapy. I've had many patients with cancer who have done conventional therapy and biological therapy concurrently. And in many cases, they do extremely well. In fact, I would say they all do extremely well. So it's not a either or, it's not you should or you shouldn't. If one chooses to do, you know, imaging and radiation, then we have therapies that we can give you to protect yourself, to decrease some of the potential, you know, harmful adverse effects that come with that type of exposure in general.